everyone. Welcome to Learners Hub Vellore. Hope you're all doing great. This session throws light on the conduction system of heart. Here we can see a typical heart. This is the sinoatrial node, and from there are three dotted lines. They show the pathways. That is, the first one is the posterior tract is the bundle of Thorel, and the middle tract is the bundle of Wenckebach, and the anterior tract is the bundle of Beckman, and this is bundle of His. From bundle of His, it divides left bundle branch and right bundle branch. They end up into PURKINJE fibers, and bundle of His, it starts from the atrioventricular node. If you just understand this first, you can very well understand the upcoming topics. Let us see the properties of cardiac muscle: automaticity, auto-rhythmicity, excitability, conductivity, contractility. And what do they all mean? What is automaticity? Automaticity is nothing but without external stimulus, heart muscle can initiate normal cardiac impulse by the sinus node, that is the SA node. Auto-rhythmicity. What is that? Cardiac muscle, it can contract after a regular interval. That is called auto-rhythmicity. Excitability. Cardiac muscle can be excited by adequate external stimulus. What is conductivity? Cardiac muscle has the ability to conduct impulse from one muscle cell to another cell. What is contractility? It is the ability to contract after depolarization. So these are the 5 properties of cardiac muscle. What is a cardiac muscle? It is a type of muscle which is present in heart. What is refractory period? It is a period during which activated muscle fibers, they do not respond to further stimulus. So they are of 2 types. The first one is absolute refractory period. During this period, the muscle fibers do not respond to any stimulus. And what is relative refractory period? With very strong stimulus, muscle fibers may respond. What is all or none law? If external stimulus is too little, no cardiac impulse is initiated, we know very well, but with adequate stimulus, all muscle fibers, they contract with its best ability. Functional syncytium. Cardiac muscle fibers, they are electrically connected with one another by a gap junction. When one muscle fiber is excited, the action potential from that muscle fiber, it spreads to the whole of cardiac muscle fibers because of the presence of intercalated disc. So, heart muscle works in the form of syncytium. It works in a group. There are 5 specialized tissues called the conductive system of heart. Okay, what are they? They are SA node, AV node, bundle of His, right and left bundle branches, and Purkinje fibers. The specialized conductive pathway, it allows the heart to be electrically activated in a predictable manner. The impulse arises in the SA node. This is the SA node. We call it as the primary pacemaker. From there, it spreads across the atria by pre-internodal pathway and Beckman's bundle. It causes depolarization of both the atria. From the atria, the impulse reaches the atrioventricular node, where there is some delay, which allows the atria to contract and pump blood into the ventricles. The impulse then spreads along the bundle of His. Then along the left and right bundle branches, finally into the ventricular muscles through the Purkinje fibers, causing ventricular depolarization. First, the ventricular septum is activated, followed by the endocardium, and finally the epicardium. So this is the sequence of impulse formation and the conduction. Coming to the anatomy of conducting tissue. First one is sinoatrial node. Sinoatrial node, it is located in the superior and right side of right atrium near the root of superior vena cava. Normally, the impulse arises in the SA node called sinus rhythm. So from the SA node, impulse spreads along the three internodal pathways. What are they? Anterior, middle and posterior into both the right and left atrium. Finally, these three internodal pathways, they enter into the atrioventricular node. And there is another additional internodal pathway. What is that? It is called the Bachmann's bundle, which is present, which transmits impulse to the left atrium. The normal rate in SA node, it is about 60 to 100 beats per minute. After SA node, coming to the atrioventricular node. Atrioventricular node is located in the subendocardial surface of right side of right atrium at the posterior part of interatrial septum, close to the opening of coronary sinus, just above the tricuspid valve. This is all about its location. Now, if sinoatrial node is blocked or the impulse transmission, that is conduction, if it is failed, what happens? This atrioventricular node, it can initiate cardiac impulse and perform as a pacemaker. The normal rate of atrioventricular node, it is about 40 to 60 beats per minute. So, according to electrical response, atrioventricular node is divided into three parts. The first one is high nodal region, that is AN region, and mid nodal, that is the N region, and low nodal, that is the NH region. Coming to the bundle of His, it is an extension of tail of AV node. From the ending of AV node, from the distal end of AV node, it starts, that is, it extends downward and to the left and to enter into the interventricular septum, that is near the junction of muscles and fibrous part of ventricular septum. Then it is divided into two right and left bundle branch. When there is an atrioventricular block, what happens? Bundle of His, it can initiate cardiac impulse and perform as a pacemaker. Normal rate of bundle of His is about 20 to 40 beats per minute. Bundle of His, now it is divided into the right bundle branch and left bundle branch. Coming to the right bundle branch, it extends on the right side of interventricular septum and it spreads into the right ventricle through PURKINJE fibers. Coming to the left bundle branch, it divides into anterior and posterior fascicles. The anterior fascicle, it spreads into the antero-superior part of left ventricle, whereas the posterior fascicle, it spreads into the postero-inferior part of left ventricle through PURKINJE fibers. At last, coming to PURKINJE fibers, these are the terminal network of fibers diffusely spread in the ventricular muscles, where, that is, they are spread into the subendocardial and subepicardial myocardium. The normal intrinsic rate of PURKINJE fibers is about 15 to 40 beats per minute. Pick the odd man out. Automaticity, contractility, conductivity, opacity. We have seen, if I guess in the third or fourth slide, I think so, that is the properties of cardiac muscles. Just think which one would be the odd one. Okay, let us see the answer for this. Opacity, it is the odd man out. So there are around 5 properties of cardiac muscles. What are they? Automaticity, auto-rhythmicity, excitability, conductivity and contractility. So opacity is the odd man out. It doesn't come as a property of cardiac muscle. I hope you got your right answer. Coming to the next question. Pick the odd man out in this. Bundle of His, bundle of Bachmann, bundle of Wenckebach, bundle of Thorel. Which is the odd man out in this? We have seen this in the second slide, I think so, in the conduction system of heart. We saw a picture of heart, a typical heart, right? Just think, just recall. Okay, coming to the answer. Bundle of His is the odd man out. Among the internodal pathways, bundle of Bachmann is the anterior one, bundle of Wenckebach is the middle, and bundle of Thorel is the posterior one. Hope you all got this right. Moving to the fill in the blanks. What is the normal rate of bundle of His, normal rate of SA node, and normal rate of PURKINJE fibers? If you have listened the class with full concentration from the starting, I hope you can answer this one correctly. Just pause this video and think of the answer. Okay, going to the answer session. Normal rate of bundle of His is about 20 to 40 beats per minute, and normal rate of sinoatrial node is 60 to 100 beats per minute. Normal rate of PURKINJE fibers is 15 to 40 beats per minute. Hope you all enjoyed this session. Thanks for watching and stay tuned for our latest updates.